Hey, everybody. Welcome to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelsen, professional horse trainer, and with me once again is my good friend Deb Romero, certified Alexander Technique instructor. So today's episode is a continuation from 2 podcasts ago. I want to say, because I did one in between with Sam.
Oh, that's right.
Yeah. So this is the last one where you and I started to talk about the importance of a paper authored by Jean-Marie Denoix, Denoix, who's a DVM and PhD. And the title of his paper is Spinal Biomechanics and Functional Anatomy. So it's a big paper and a really important research paper that was kind of a paradigm shift in a lot of research on horse biomechanics and equine movement. So this paper, I think we're going to have one more podcast just on this paper. It is a lot to digest. Yeah. Yeah. So the first podcast where we started on kind of digesting all this information is titled Spinal Biomechanics and Functional Anatomy. This podcast is a continuation, but I'll probably have a different title because today we're going to talk specifically about how the movement or displacement of the vertebra up and down, dorsal and ventrally, is different throughout the spine. It's not uniform from head to tail, even though we call it longitudinal flexion and longitudinal extension, which longitudinal means the entire spine, flexion meaning an upward force of the whole spine, and extension meaning a downward force of the whole spine. But through this paper, what Jean-Marie Denoix really talks about is how there's local areas of the spine where the movement of the vertebra can be significantly more or less compared to other vertebra of the spine. So that and the relationship of the use of the neck to the back.
Yeah, that blew me away. Yeah.
That's huge. And that's what I want to kind of start with is sort of that relationship of the use of the horse's neck directly to the use of the horse's back or the thoracolumbar spine related to flexion and extension. So that's our topic for today, is really a segment of this research paper, but specifically looking at dorsal ventral flexion up and down of the spine and the relationship between the neck and the back on the horse. And actually, Deb, I'm going to have you start because Alexander Technique specifically addresses the relationship of the human neck and back. Like that is the whole deal in a nutshell.
Pretty much, yeah.
It starts with the head and neck balance of the human. So can you sort of talk about the importance of that from your experience and your education with people?
Well, it's interesting because that what we're talking about on the paper is there's a practice. A lot of people in the Alexander community feel that they always start with the head-neck relationship because that affects the whole use of the spine. So if you don't know, if you're backing down, how does that affect it? Or if you're, rolling your neck forward, how does that affect it? So finding that.
Sorry, what you're basically saying is flexion and extension of the cervical vertebra.
Yeah.
So
the same thing.
So is the point of reference on the human the front of the spine or the back of the spine when we say flexion and extension?
Well, if you do it anatomically, it should be the front of the spine.
So when the bones of the neck are widening at the front, that's what we call extension.
Correct.
And when the bones of the neck are narrowing at the front, or the vertebra are coming closer together at the front of our neck, that's flexion.
Yes.
Okay, that's exactly the same for the horse, except
yeah, that's cool.
Except front and back, we say ventral is the bottom side of the horse and dorsal is the top side of the horse.
Right.
Okay, so if the human has excessive extension, that's going to tilt the chin up and the top of the head back and down. That's what you mean.
Yes.
Okay. Same for the horse.
Same for the horse.
And then if you say you could have in the human too much flexion, which would drop the chin way down and tilt the top of the head forward rather
Yes.
than remaining vertical.
Yes.
And so what's the importance of that in the Alexander world?
Because that affects the use of the entire body.
And how does it do that?
Because if your axis, as we talked about way back in some podcasts, if your axis, your central nervous system is not being used properly, then you have dysfunction that goes out to the limbs, just like with a horse.
Right. And so if we think of the brain and the spinal cord, the central nervous system is going to influence all functions of the body.
Right. It's kind of like the worst case scenario. I always tell people, you can visualize it, is somebody using a walker because they have given up all spinal integrity and they're balancing from their arms and their legs.
Okay.
That's kind of the, most people can get a picture of what that is. So,
and that would be similar to a horse that's either a high-headed horse in what we would call the posture of extension, or a horse that's in long and low habitually with, the neck down, the head down.
mm-hmm.
They're basically balancing on their front legs.
Right.
Which would be like a human balancing with their arms on a walker.
Yes.
Yeah, and that's going to throw off perception as well as athletic ability. It's going to throw off perception. So I think you said once, I'm crediting you for this, that the really vital importance of the neck is that all of the proprioception that's available in the receptors of our muscles, like that information, if we think of it traveling from the limbs or the body to the brain, the neck is where you have the narrowest part of the channel.
Yes, could be.
Didn't you say that?
I don't remember saying it, but who knows?
Well, it stuck with me. I thought you had said it, but it's like that's sort of the importance of the function of the neck is it's a delicate, easy to disturb, narrow channel to the brain, or from the brain to the body, from the body to the brain. It's like that's where it's a fragile, delicate system and a narrowing of the information channel. Like there's not a lot of protection around the spinal cord at that particular area of the body.
Yes. Very delicate.
And so the head neck balance, do you start there as an Alexander instructor, or is that just a common place to start?
I've been taught that is the place to go to, but if I can't receive or get information from that location, I'll go somewhere else where I can communicate.
And so give me an example of that. Like, what do you mean? If you can't communicate there, how would you know that?
Lack of mobility, somebody that is so tense and tight, or I always say people that are kind of disconnected.
Mm-hmm.
Their brain doesn't talk to their body. They're totally disconnected. I'll go maybe to the ribs or something like that. Go to breath work and do breathing to see if I can get in, shall we say.
Okay, and that's I think that sort of leads into like the use of the neck and the back. Well, the neck to back relationship in the horse is not that dissimilar to what you're describing with people. So in other words, like we tend to think as riders that the beautiful sort of forward lengthening upward use of the horse's neck, that perfect headset, as we call it, or
Mm.
that perfect collected position of the head and neck. As riders, we tend to start there. Like we want to use the reins or a gadget to manipulate the elevation of the pole, or lengthening the neck somehow, or creating an arc to the neck that sort of fits with this image we have of a collected horse. But it doesn't always work. Like you're describing, if there's too much muscle tension already there, or if the horse is, what I want to say, kind of corrupted in the use of the head and neck, or we could say dysfunctional. So what you're saying is when you put your hands on people, sometimes the dysfunction there is sort of blocking your access of getting any change.
Yes.
And the same is true for horses, because we tend to think we have to frame the head and neck in order to lift the back. Right. And that's just so untrue. It's so damaging. Because
Yes.
that would be like you as a body worker saying, we're going to get your head and neck here, and your back will follow. And so how would that work for people?
It's a delicate dance, and I think it is with horses too. Helping somebody find a more neutral way of being on the planet without it messing me up at the same time. So being true to the work is making sure I'm using myself well when I put hands on people.
And that's how you guide the body into better function.
Yeah.
Is through the use of your body.
Yes.
Yeah, that's just like a rider on a horse. It's through the use of our body that we help guide the forces of motion from the use of the horse's body. But we're not really manipulating body parts. And so as soon as we try to use our reins or a gadget or leverage to position the horse's head and neck in order to lift the back, I got to say, like, the odds of getting that right are like winning the lottery. I go, what we see is not always what the horse is doing mechanically.
Yes.
And the use of the neck can influence the back. But if the neck has a kind of corrupted use because of it's doing a job it shouldn't be doing it, or it's manually manipulated, you're not going to have a positive influence on the back.
Exactly. And all of that, those words like framing, all of that to me is a position where it can't be a position. The bodies are dynamic and constantly fluid and moving. So there is no place.
Right.
And I think that's the biggest thing for the human to understand, that it's not static. It's not a place, oh, I've got it and it's going to stay.
Yes.
That's a big misconception.
Well, and what you're saying is a lot of times you can go somewhere else in the spine, upper back, lower back, pelvis even.
Yes.
And that will begin to sort of cause positive changes in the function of the neck.
Yes.
And the position of the head.
Yes.
Okay. And that's exactly more often how we have to work with horses.
Yes, I agree. I know it's taken years to unravel the dysfunction in my horse's necks from misuse by me. I admit it.
Oh, me too. Me too.
Totally,
if we haven't made a bazillion mistakes and gone the wrong way, you wouldn't know how, you wouldn't have anything to compare. So it's important that we make mistakes and screw it up on a regular basis. And the same for our horses. Like that's how they learn, right? So that sort of leads into when we're working with horses to lift the back. I look at it like, maybe because they're quadrupeds versus an upright biped human, that the stability of the the back, which is technically the thoracolumbar spine, the pelvis, the sacrum, if I don't address issues there first, I never get a really ideal function through the cervical spine.
Yeah.
So anytime, and it's come to a practical level where I could safely say the use of the horse's neck is more a reflection of the use of the back than it is a tool to lift the back.
Oh,
So
that's a good one.
instead of the neck creating an alternate use of the back, I look at it the other way around. Changing the use of the back is what creates a perfect head and neck position.
So you're working kind of back to front, where the old methodology is work front to back.
Right.
Okay.
Like I can't tell you how many times I've heard you can't lift the horse's back without rein resistance or a rein contact.
Wow.
And I just find that blatantly untrue.
I do too.
I
agree.
I have lots of horses I've worked with that had, like you're describing, if the neck is really locked or dysfunctional, or the horse has a fear of the reins or bit, right? Because that can happen too. There's a lot of workarounds. There's a lot of ways to increase flexion or stability of the back and pelvis that involve very little, very light use of the reins.
Yeah.
And that can restore healthy function of the neck.
I agree.
So we better tuck into this paper.
Okay.
Because there's a bit to cover.
Just a bit.
But I think you pointed out something. So we're going to talk about two things. The sort of the spontaneous or chosen use of the horse's neck and how that relates to dorsal ventral flexion and extension of the thoracolumbar spine. But what caught my attention first was the greatest range of dorsal ventral movement, up down movement of the vertebra, appeared at the lumbosacral junction, L5 to S1.
I know, that was amazing to me.
Yeah, which is directly related to what we call engagement, because it's going to affect the mobility of the pelvis around the hip joint. Moreover, differences in regional mobility were recorded between T5 and L5. So almost the entire thoracic spine and lumbar spine. So we could say the thoracolumbar spine, but the first early thoracic vertebra don't move very much, which is connected into the lower cervical vertebra. So he doesn't really even talk about the neck or the wither area, sort of up between the shoulders, as having a high range of mobility.
Yeah, and I think I read somewhere that it later in the paper, it has to do with the rib cage.
Exactly.
And the sternum, because all of that is conjoining right there. So there's not going to be much thoracic movement.
Also, I think the length of the dorsal bones.
Yes.
Yeah. And that was more influenced by the nuchal ligament than it was muscularly.
I think people forget about that type of tissue. Ligamentous tissue there's a ton of ligaments around the human spine and the horse's spine, very long, because just for support.
Also suspension, so that it makes muscle activity less laborious. Like you don't have to use as much muscle. If you have a big, strong ligament, that ligament is going to do more work than the muscle, which gives you ease of motion and efficiency.
Yes.
So it blew me away that during flexion, the average amount of displacement in the lumbosacral joint was 12.3 degrees, but it could reach 20 degrees in a single specimen.
That's huge.
That's a huge range of motion. And the subset between T14 and T18 seemed to be more flexible than the rest of the thoracolumbar spine. So measurement of intervertebral mobility revealed that the amount of flexion was higher in the thoracolumbar junction, particularly between T17 and T18 and between T18 and L1, where the
Right.
angular displacement could reach 3.6 degrees.
Wow.
And 3.6 degree movement of a vertebra is significant.
It is.
It's not meant to move a lot or the spinal cord would snap and game over.
Game over.
Right? You're in a wheelchair and there are no wheelchairs for horses. So
That's true.
yeah. So those degrees I thought were really interesting. And it says the least movement took place at both extremes of the thoracolumbar spine. So in the joint complexes between T3 and T19, it sort of gradually increased from front to back. So the least amount of mobility was sort of at the upper part of the thoracic spine and the lower part of the lumbar spine, sort of less movement between the vertebra, where we could say at the base of the neck between the shoulder blades to the withers, and then it increases where we sit under the saddle to behind the saddle, all the way to the junction of the thoracolumbar spine, I think being the peak, or sorry, the lumbosacral junction sort of being the peak, and then kind of decreasing mobility again into the sacrum.
Yes. Yes.
And the junction where the thoracic spine meets the lumbar, thoracolumbar junction, and where the lumbar meets the sacrum, the lumbosacral junction, those particular junctions had increased mobility compared to the rest of the vertebra of each segment of the spine.
Yeah, and I find it interesting that the amount of mobility underneath the saddle and what we as riders, I don't know if we think about that.
No.
because
the whole idea of move with the horse, if you think of a body, weight and mass, right?
Mhm.
Moving with the vertebra. Let's say you have dysfunctional vertebra or there's too much movement, which is now risking the integrity of the spinal cord.
It's amazing.
How would the body naturally protect against excessive force that's risking an injury to the vertebra that protect the spinal cord? Everything's going to tighten.
Right.
Right? You're going to have severe back pain or you're going to have severe chronic muscle pain, just protecting excessive mobility of the axial skeleton or the spine.
Right.
Right.
Would you put kissing spine into that category?
Well, kissing spine is long-term downward force of the spine to where the muscles are giving way and even the ligament system supporting the integrity of the spine is starting to weaken, which is allowing the dorsal or the top spinous processes part of the bones vertebra to start touching bone to bone. Mm-hmm. So that's something, it can be a congenital issue. I had a horse where it was congenital, but he also had terrible feet. He had a connective tissue issue from head to toe.
Wow.
And when we first x-rayed him, he had 13 kissing spine and he had been ridden less than 10 hours. He had not been ridden very much.
Oh my gosh.
And he had 13 vertebra that were touching and one to the point that it had fused.
Interesting.
It had been going on so long. So here's a horse that just didn't have a strong ligament system and certainly hadn't developed the muscle to prevent the spine from dropping downward too much to where the spinous processes or dorsal tips were touching. More often than being congenital, it's a functional training issue.
Yes, it is.
Right.
And that whole thing, like you said, move with the horse and people just not realizing how much they influence that mobility issue by moving with the horse
Well, not
instead of,
only that, if we look at the neck, what you described with dysfunction in the human, if the top of the head is pointed too far forward in front of the vertical line of gravity or behind the vertical line of gravity, we have dysfunctional use of the cervical spine,
right.
right? Same is true for a horse. So we could say the very same thing. If the chin of the horse is lifted, then between the ears, the skull is sort of pointed backwards towards the rider,
That makes sense.
right? And so the neck is going to be, the vertebra are going to be coming too far apart at the base of the neck, which on human would be the front and on the horse would be the underside of the neck. And at the back of the neck, under the mane, the vertebra are coming too close together. They're flexing too close together, right? So that's extension. And if that's happening in the neck, we know it's happening in the thoracolumbar spine as well.
Yes.
Unless humans put leverage in the jaw, right? So if we put leverage on the horse's head, we can make the neck go forward and down and create the opposite problem of too much flexion in the neck. And it's quite possible, easy to do actually, that if we restrict the horse's neck, thinking we're creating a frame, then as we over curl, the chin will come towards the torso on the horse. The head will still be moving backwards, but the top of the head will be pointed forward, and we think that's collection.
Ouch.
Yeah. And they can do that while the thoracolumbar spine is still pushing downward in extension, which creates a tremendous amount of strain on the body because now the neck is in hyperflexion and the back is in extension. It's no longer a congruent spine. It's going two different directions.
Unfortunately, I see that a lot.
Yeah, it's easy to do with leveraged bits and head setting gadgets and training devices.
And us being so controlling with our hands.
And the thought behind it is that if we get the neck to flex, the back will flex. And I go case after case after case. I could walk into any barn today and show you 3 examples of a horse that's doing the opposite.
Yeah.
Putting the thoracolumbar spine in extension while the neck is in hyperflexion. And I think when we look through this paper, the explanation is in those junctions between the thoracic and lumbar spine and between the lumbar spine and the sacrum. Right? They can make up the difference with the high range of mobility.
Yeah.
And I think that's the functional kissing spine, which is just a mechanics issue. It's how we influence the use of the spine in training. When we overcurl the neck forward and down, we might think, excuse me, we might feel like the horse is lifting their back because we might feel big fluctuations in those joint areas, while we're at the same time in extension, developing kissing spine in other areas of the spine.
Yep.
Right. So those forces of motion can be confusing when we start to have significant influence over the position of the horse's head and neck. That's what's so dangerous about it.
Yeah, I think so. Yeah. When we think we can create the balance by using the hands, that's what gets us in trouble.
Or manipulating the neck position.
Yeah.
There's a lot of ways to be wrong. And there's about 1 in 10 million single way to be right.
Yeah.
Right.
I agree.
So with all that said, what caught your attention that you pointed out to me in this paper was displacements due to cervical flexion. Right? So a lengthening of the neck. So the shortening of the neck muscles whether it's the head going up and back with a short
Mhm.
neck, or the head being overly curled forward, coming back to the torso with a short neck, it doesn't matter. That's putting the cervical spine and the thoracolumbar spine basically in extension.
Exactly.
But when the horse lengthens the neck and
Mhm.
creates space between the cervical vertebra, you had pointed out what he said in the paper: the lowering of the neck provoked flexion all along the thoracic spine. Intervertebral movements were greater between T6 and T10, where the average amount of flexion was 1.7 degrees.
Bingo. I
So
love that.
I know you love
I
that.
was like cheering, going, ah, yay!
Okay, so explain in practical terms, what does that mean? What are we going to see? What are we going to feel? Why is that important to you? Well, first of
Good
all, why
point.
is that important? Why did you jump up and down?
Because we've been toying with that for years. It's nice to see it in writing in a scientific paper that yes, that's what's going on. That lengthening the neck allows the nuchal ligament to stretch, which lifts the back.
Yes, so you have a ligament influence over the
Yes.
vertebra.
Mhm.
Yes, because that nuchal ligament goes from the back of the horse's head basically into what he's calling the mid to caudal thoracic, so T9. And then that same ligament increases in fibers. It becomes less stretchy
Right.
and more dense as you, but it's the same ligament
Right.
system. It's like a connection of ligament from the head to the tail.
Exactly. And it's the same in humans.
Right. But it
We have a nuchal
changes,
ligament too.
right. But it changes stretchiness,
Mhm.
right? So from the head to just behind the withers is the most stretchy part.
Right.
And then it becomes increasingly less stretchy as you move towards the tail, but it's still supporting sort
Right.
of the flexion of the spine.
Yes.
Yes. Suspending the spine, we could kind of describe it that way.
That's a
Kind
nice
of,
way. Yeah. That's a
and
nice way to
that's
put
where
it.
the muscles, when that ligament is able to fully function, the muscles work less.
Right.
That's the point of having big, strong ligaments.
And ligaments can handle a higher tensile load
Yes.
for a longer period of time than a muscle can. Muscles aren't set to do that. They're to contract and let go. That's what muscles are for.
Right. Right. I heard it described once that muscles are like the quality of rubber bands and ligaments are more like elasticon. Which if you're not a horse person, you
You
might
don't
not
know
know
what
what
that means.
elasticon is.
It's this sticky, great stuff that's never comes off.
Yeah, so non-horse people might not get that reference, but if you've ever had to wrap a horse's foot or leg, you know what elasticon is.
Yeah.
You stretch it and it doesn't rebound.
Right.
If you overstretch a ligament, it stays stretched,
Mm-hmm.
but it can take a lot of force. So
Mm-hmm.
it's not just the glue of elasticon that holds the bandage in place. It's the tensile strength of
Yes.
the material that lends it support.
That's a good one.
Yeah, I don't even know how to come up with a non-horse
I can't either.
analogy
I'll
of
have to think on that
elasticon.
one.
I know. Very, very, very strong, sticky bungee cord.
Yes. Maybe.
Like
Yeah.
maybe a short, dense, super fibrous bungee cord. Um, so so what else, like what did you picture when you pointed that out to me,
Mm-hmm.
that the lowering, we could say lowering or lengthening of the horse's neck provoked flexion all along the thoracic spine?
Mm-hmm.
How did you picture that? What did that mean to you?
I picture, and you get the same thing in people. We call it, just extending the spine, opening up the spaces for the discs to move. I think he even mentions in here about by lowering the head, the dorsal tips right by the withers go to vertical. And I thought, that is so cool.
The verticalization.
Yeah. And
yes.
And he even mentions it about, that's a kissing spine thing. That's, that's what we need to be working on.
The antidote to kissing spine.
Yeah.
Yes.
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 So, and I thought, wow, it's so simple.
It is so simple, because I go kissing spine, which scared the bejesus out of me when my horse had it congenitally.
Nobody likes that diagnosis.
No, and the only remedy from veterinarians was surgically shaving the bones to create more space between the dorsal tips.
And that's amazing, because in the human world,
the
you see that too.
Yeah. And really, if you think about the functionality of the spine, every time, if you're lengthening or lowering the horse's neck, now this is not lifting the back. That's where things get confusing for people. But what it does create is more degrees of space between the vertebra. So if we think of creating more space between each vertebra, right, and that's going to start pulling the dorsal tips apart, the nuchal ligament as well as the muscle, increasing the degrees of space between those bones.
Yes.
That can be a function of muscle and ligament.
Yes.
Right.
But it's functional. It's not static. So to me, shaving off the dorsal tips, that's not functional. That's not changing.
It doesn't change the function of the body at all.
So you could still have the same problem.
Absolutely, because you could keep shaving off bone, and if the spine is still pushing down, they're just going to keep coming closer and closer together.
Right.
Yeah. So I would say even that surgery really isn't a long-term solution. And just like with people, back surgery is risky. I can't imagine back surgery on a horse. That would be really risky. So you just have a really high risk factor for a low effect factor.
Yeah. And I think it what this paper brings that makes so clear to me in our work is that it's not static. It's not a position. It's not a place. It's a function. It's the physics we've talked about in previous podcasts.
Right. Right. So he says in the paper, when the cervical spine is flexed, and let's just say lengthened, because I think it's dangerous to say flexed.
I think you're right.
In the horse world, because people think about cranking the neck in with the reins. Yeah. So we're just
That's not flexion.
It's not flexion. It's not neutral. So, so if we say the neck lengthened, then basically it was creating anywhere from 0.1 degree to 0.9 degrees of intervertebral joint space unequally throughout the spine. But that was sort of the increased degrees of space created between the joints of the vertebra. And there was something he said about the muscle. Do you remember that part? Let me see if, oh, here it is. It was the Erector Spinae muscles.
Yeah, the Erector Spinae muscles are all, and the humans have them too. There's 3 of them, but they're just the long muscles that run, say, from the withers down towards the sacrum.
Okay.
Big, long muscles that run along the back.
And so that's what you picked up on. I underlined the lowering of the neck produces a verticalization of the spinous processes in the withers, and therefore a stretching of the Erector Spinae muscles.
Yes. So and we've talked about this before, how as an Alexander teacher, using the muscle in its length is,
Yes.
is much better than having it shortened. So keeping that elastic, functioning in an eccentric load is much healthier than the alternative.
Yes. And so I don't want to get too far into it today, but just in sort of thinking about and researching directions of force related to different types of muscle contraction in a really general way, when the back is pushing down, when the spine is going into extension, it's always coupled with concentric contractions. And that direction of force, a concentric contraction, is just a shortening of the muscle fibers coupled with increased force or contraction of the muscle. That has an inward direction in the body.
Yes.
Right? So it's basically pulling forces inward and downward.
Yes.
Whereas eccentric contraction, which just means the muscle is lengthening and contracting, is generating forces that are going outward from the body. Right? So, and that's a little bit what we talked about with the muscle. The belly does not lift the back.
Right.
It's the back muscles in eccentric or lengthening contraction, plus the nuchal ligament, that are suspending or sort of pulling the spine upward in flexion, or shortening and pushing the spine downward into extension.
Right.
Nothing to do with the head and neck. Right? So if we're thinking about those back muscles and the use of the thoracolumbar spine, what I find, just like you found, is if I play with the use and the function and direction of force in the back muscles, the head and neck alter position spontaneously. And that's what you're saying you do with people.
Yes.
Yeah. So I don't need bit leverage to influence changes in the back muscle use.
I think that's the biggest concept to get through today, that it isn't about leverage at all.
Right.
To get flexion. Obviously, he's stating it right here. The lowering of the neck provoked flexion in the back. So
right. It didn't lift the back, but
nope.
It created more space between the vertebra. And like you're saying, allowed the nuchal ligament system to start to do its job of supporting the spine. And I find if that's in place, then if I have a very light rein contact or no rein contact, we can increase flexion, especially in the more mobile parts of the spine, which are the end of the thoracic, like the, say, T9 to T18 part of the thoracic, and through the lumbar, and even influence the sacrum.
Yes.
Right? And the lumbosacral junction, having that high mobility, is going to dictate or influence rotation of the pelvic bone, which is the engagement or disengagement of the hindquarters. It's like putting together a Jenga puzzle. It's or a house of cards.
House of cards.
So that's why, like with body work, the carrot stretches or the stretches that we can use with a horse in a static therapy can have some benefit. Yeah.
But it's truly what I find, and it's working with people. When I was in Alexander School, one day a week, we had to bring in an activity, whether it was pushing a vacuum or whatever. And of course, mine was lifting water buckets and crawling through fences. And how do we use ourselves when we're doing that activity?
Right. Because that's really where the rubber meets the road.
Exactly.
And if our horse, if we want to start lifting the horse's back, then rein restriction and trying to get a headset is actively working against that goal.
Yeah, because everything shortens and contracts.
right, which is going to create inward force, which is going to be a downward force of the spine.
Yes.
So encouraging anything that lengthens the neck during motion with our horse.
Good point. During
We,
motion.
during motion, we could say is the beginning, just the
Yes.
most baby step of lifting
Baby
the back.
steps. Yeah.
Yeah.
Or just allowing length first. It's kind of like, I don't know if you see this working with riders, people. Most people go from too much tension, too much muscular effort, and then they go the opposite direction because they don't know what tone is. They don't know what the appropriate
Right.
use is for that activity.
And the same with horses, like in the process of discovering any coordination, swimming, riding a bike, lifting your wheelbarrow, picking up buckets, all of those are functional coordinations,
Yes.
right? So if we do it with too much tension or too much shortening of the muscle, we have dysfunctional use of the spine to go along with it.
Yes.
Right. And then we're told, relax, let
Yeah.
go, do
The
nothing.
opposite.
Right. Do the opposite, which is not entirely the wrong advice because it's sort of the right direction.
It gets you out of where you are.
Right. But if we had no muscle tone, you couldn't lift water buckets. You couldn't push a
Right.
wheelbarrow. You would slide off the horse. You couldn't even stay in the
Right.
saddle. So we can have too much muscle tension and we can have too little.
Yes.
So tone to me is always like somebody asked me, what's the difference between tension and tone? And it's a good question because what is the difference? They're both describing muscular contractions.
Well, to me, it's the tension is shortening and getting smaller, losing height. Tone is still staying in your length and being able to do an activity without.
Oh, that's interesting.
Yeah.
Yeah, because my answer to that question was that the difference between tension and tone was the appropriate amount. And I like your answer better, that it's the difference between working with muscles in length, whether it's isometric or active, right? So isotonic is a change of muscle length with contraction. Isometric is the current length of muscle with contraction. And then eccentric is a long muscle and concentric is a short muscle. So it's just describing changes in the muscle body during contraction. And for a horse to lift their back, those back muscles, which are working in equal doses of postural stability, as well as managing forces of motion or locomotion, they have to be in length to do both jobs.
If a muscle is already contracted, that shuts down all the proprioceptors that go from that muscle to the brain.
So shortened or any length?
Shortened when they're contracted.
Shortened. Okay.
Yep. When they're shortened, it shuts down the proprioceptors to the brain.
Because everything's drawing inward in a protective mode.
Yeah. That's like freeze, when somebody or a horse just stops and freezes, they've pretty much shut down.
Yeah, absolutely. Yeah. And that is a dangerous moment because they tend to explode into fight or flight right after that moment.
Yep.
So when we see a high-headed horse, like some people will say, first of all, the pole is up. Okay, technically, yes, the pole is above the back, but the head is pushing backwards towards the torso. And using bit leverage to just make that reverse curl, the neck is still shortening.
Correct.
Right? So anytime we see the muscles of the neck shortening, we know that's directly related to the neck and the back possibly going into downward force, inward force, which is
and unfortunately
extension.
I see it in a lot of upper level competitions.
Yeah, when I was jumping, that was what you wanted, a high-headed horse with ears pricked away that was keen to the jumps. And I go, maybe they're afraid, or maybe they're just doing the best they can in this, what I call kind of an instinctual posture of fight
Yeah,
and
that's
flight,
true. Mhm.
right? And I think in Alexander work, they call it the startle posture.
It's startle, yeah.
Mhm. So I
And
go,
you just can't stay that way. I mean, being able to startle is a good thing, but it shouldn't be the place where you're ridden all the time.
right,
Yeah,
the
it shouldn't
habit
be where you live.
or the most prevalent posture during use. That's when it
Exactly.
becomes dangerous.
Yes.
So was there anything else from this paper? Oh, and this goes directly to the kissing spine. This is what I wanted to mention. The lowering of the neck can be considered an analgesic effect in horses that suffer from impingement or overriding of spinous processes.
Bingo.
Ding, ding, ding,
I
ding.
got big stars on that one.
Yeah, did you?
It's like, yeah.
Yeah.
You
So,
can't say that enough as far as I'm concerned.
and I think kissing spine has become a prevalent problem in the horse business because of how we think that we need rein contact in order to lift the back, that we have to position the head and neck in order to lift the back and engage the hindquarters. Which, if that were your belief as an Alexander instructor, you would probably have the same sort of systemic dysfunctions by trying to manipulate the neck.
Yes. Because it truly, and I think this is kind of bringing it all together, it's truly about influencing the horse, or if I'm working with somebody, to find their best use,
Right.
not putting them somewhere that I think they should be.
Right.
Yeah.
I
So,
think the other thing, and I talked about this with Sam a little bit, who does body work, and we talked about myofascial release, was we can sort of create too much more mobility or too much restriction that really takes away from the inherent stability needed in the axial skeleton that protects the central nervous system.
yes. And I think it changing our thinking, because I'm sure you hear this too. Is this the right place? Am I in the right place?
Right.
That to get away from that, to really focus more inward on what is that for me today doing this activity.
Right. Right. And if a horse can't move with a long neck, I think we have much bigger problems. Like, I think if we talk about the neck to back relationship, the perfect headset to me has to come secondary to increasing flexion of the thoracolumbar spine.
Yeah,
And
I
the,
agree.
and the horse feeling stable in the back and hindquarter. Because as long as the back and hindquarter remain unstable, the neck and front legs, shoulders have to take over the job of stabilizing the body in motion, or everybody would fall over.
And I
So,
see that. I see horses with these huge front ends and little tiny back ends.
yes. So the job of just essential stability during motion can be not where it's supposed to be, which is the back and hindquarter, and can be maintained by the neck and the front limbs. And the more we try to lift the back by restricting the head and neck, the more often we get front instability. So as soon as you take the rein pressure away and you allow the horse to lengthen the neck, oh, what you get is a boatload of instability at first,
Yeah,
because
you
the horse
do.
is like, wait a minute, that was my walker. What do I do without my walker?
And yeah, and then I see people going to bigger bits because they can't sustain it.
Right. Right.
Yeah. The bigger bit theory. Get
Yeah. So even when I'm starting young horses under saddle or restarting horses, either because of lameness issues or behavioral issues, one of the first things I look for to know that I'm on the right track is the horse spontaneously choosing to lengthen the neck and move the skull forward and away. It might
Yes.
not be perfect. The head might be too
Right. But at
high,
least
too
if they can do
low.
that and walk, that's a good thing.
Absolutely. And so it made me very patient and tolerant with bit snatching, rein snatching. I'm like, oh, okay, it's happening faster than I thought, but it's happening. Right. Or if a heavy horse wants to lean on my hands, I just loosen the reins and go, no, we're not front end
We're not going
balancers.
there.
We're not going there. Right. So it's interesting that just the lengthening of the neck can sort of help restore the proper function of the nuchal ligament, can create more space between the vertebra, and maybe at least I kind of picture it like the spine is no longer actively pushing downward, but it maybe isn't lifting upward enough
Not
to
actively.
have collection,
Yeah.
right? But it's never the spine, any bone in our body is never completely neutral. It's always moving
It's
to some
dynamic.
degree,
Yeah.
right? So what we're really doing is, especially when we ask the horse to lift the back, which is longitudinal flexion, that neck is going to be included with the lifting of the whole thoracolumbar spine, right? So if we're talking longitudinal flexion or upward force, the pole and the long neck elevate at the same rate that the back thoracolumbar spine and pelvis can elevate.
Yes.
It all goes together.
Yes.
So anything else you wanted to point out from this segment of the paper?
No, that was my favorite part of the paper so far.
Yes. And I think after this point, we're going to start getting into lateral flexion and rotation.
Okay.
So the last part of this paper, which is really the meat and potatoes of this paper, this was the breakthrough part by Jean-Marie Denoix, he was one of the first people to really break down and help us understand the combination of lateral bending with the function of rotation in the spine, in the horse's spine.
Yes.
Which in 1999 was breakthrough information, and it still has not filtered into, on a practical level, it has just not filtered into the horse business at all. So I'm super excited to talk about the last part of this paper in the next podcast, but I think that's enough for today.
Yes.
Yes. It's just such a cool paper. And so once again, you guys, I will put the paper in the notes. You can find it at like PubMed or any of the places that provide or sell research papers. And the title of the paper is Spinal Biomechanics and Functional Anatomy. The author is Jean-Marie hyphenated D. Denoix, Denoix, DVM, PhD. And I think I'm on my 5th reading of it and I'm still digesting.
Yeah, I'm still digesting it.
Yeah. Yeah. So thank you guys for joining us. We hope to see you back here the next podcast. And oh my gosh, my head's spinning from everything we talked about today. So I'm just going to say cheers.
Cheers.
Cheers. That's
Be
enough
kind,
for
everybody.
today. And we'll see you next time on the Horse Geeks podcast. Thanks.